Experiencing a dry socket can be one of the most painful complications following tooth extraction. Dry socket, also known as alveolar osteitis, occurs when the blood clot that forms after an extraction gets dislodged or fails to form properly, exposing the underlying bone and nerves. Understanding how to treat and manage dry socket is crucial to alleviate pain and promote healing. What is dry socket? After a tooth is extracted, the body naturally forms a blood clot in the empty socket to protect the bone and nerves. In cases of dry socket, this blood clot either dissolves or becomes dislodged, leaving the area exposed. The result is intense pain, often radiating to the ear, jaw, or other parts of the face, along with foul breath or an unpleasant taste in the mouth. Symptoms of dry socket: severe pain starting 2 to 4 days after tooth extraction, visible bone in the socket, bad breath or unpleasant odor from the mouth, foul taste in the mouth, pain that radiates to other areas like the ear or eye. If you experience these symptoms after a tooth extraction, it's essential to contact your dentist right away. Prompt treatment can prevent the condition from worsening and speed up recovery. You must know how a dry socket is treated. The first step in treating dry socket involves cleaning the affected area. Your dentist will gently flush the socket with a saline solution to remove food debris and bacteria that may have accumulated. This step reduces the risk of infection and relieves some of the discomfort. Medicated dressings. After cleaning the socket, the dentist may apply a medicated dressing or gel directly into the socket. This dressing helps to soothe the exposed bone and nerves while promoting healing. It may contain ingredients like eugenol, which is derived from clove oil, and provides pain relief. The dressing may need to be changed every few days until the pain subsides, and in some cases, the patient might be instructed on how to change it at home. Pain relief. Over-the-counter painkillers like ibuprofen or acetaminophen can help reduce pain and inflammation. In cases of severe pain, your dentist may prescribe stronger medications to provide relief. It's important to follow your dentist's instructions on medication usage to avoid complications. Antibiotics, if necessary. Although dry socket itself isn't an infection, there is a risk of bacteria entering the exposed area. In some cases, your dentist may prescribe antibiotics to prevent or treat infections, especially if there are signs of infection like swelling, fever, or pus. Managing dry socket at home involves taking proper care of the extraction site and relieving symptoms. Here are some self-care measures. Avoid smoking. Smoking is one of the primary risk factors for dry socket. If you smoke, avoid it entirely during recovery, as it can delay healing and increase the risk of infection. Rinse gently with salt water. After the first 24 hours, rinse your mouth gently with warm salt water, about half a teaspoon of salt in 8 ounces of water, several times a day to keep the area clean. Avoid using mouthwash unless your dentist prescribes it. Avoid hard or crunchy foods. Stick to soft foods like soups, mashed potatoes, yogurt, and smoothies. Hard or crunchy foods can irritate the socket and dislodge any remaining blood clot. Practice good oral hygiene. Brush your teeth gently, avoiding the extraction site. You can also use a soft brush or cotton swab to clean around the socket. Follow-up care. Regular follow-up visits with your dentist are essential for monitoring the healing process. If your pain persists or worsens, let your dentist know so they can adjust the treatment plan. Preventing dry socket. While not all cases of dry socket can be prevented, you can reduce your risk by following these guidelines. Follow post-extraction instructions carefully, including avoiding vigorous rinsing or spitting for the first 24 hours. Avoid using a straw for at least a week after extraction, as the sucking motion can dislodge the blood clot. Quit smoking before and after the extraction. Smoking increases the risk of dry socket due to the chemicals and physical action of inhaling. Maintain good oral hygiene to minimize the risk of infection. How long does it take to heal? With proper treatment, dry socket generally heals within 7 to 10 days. The pain often begins to decrease within a few days of treatment, especially after the application of medicated dressings. If you take care of your mouth and follow your dentist's instructions, your healing time may be faster and you can avoid further complications. Dry socket can be a painful and frustrating complication, but with prompt treatment and good aftercare, it is manageable. The key is to seek help from your dentist as soon as symptoms appear and to follow the recommended treatment plan closely. By doing so, you can reduce your discomfort and ensure a smooth recovery process. If you've recently had a tooth extraction and suspect you may have developed dry socket, don't wait. Get in touch with your dentist as soon as possible to get the relief you need.